Hello friends, today we'll talk about the Canadian C-spine rule. So what is this Canadian C-spine rule? See, basically this rule is seen after the blunt trauma to the patient head, and it is essential to screen for the fractures, dislocations or ligament instability. The ultimate goal of this Canadian C-spine rule is to take whether the radiograph or not for the particular patients who comes after trauma with the blunt injuries. So this is based on the risk factors like major risk factors, lesser risk factors, and based on the risk factors we'll use the C-spine formula, and in that we will evaluate further whether the patient needs the X-ray or CT spine, whether he or she needs or not. So let's get into the video. So in this Canadian C-spine rule, what you're seeing in this video is the risk factors which I've mentioned. So kindly note it down. So first thing is the patient who is having any high risk factors, whether it is present or not. Those high risk factors are the age should be 65 or older, if any paresthesia is present in extremities, or if any dangerous mechanisms like fall from height of more than 3 feet or 5 stairs, and if any axial load to the head has been given, for example in a diving case history, and multi-vehicle accident at high speed, or any rollover injuries or any ejection from the seat of a particular vehicle, and bike collision. So these are the dangerous mechanism, and if patient comes under any of these high risk factors are present, then you can go for the radiograph. But coming to the low risk factors, whether the patient is having any simple rear end collisions, whether the patient is sitting in here in a stable way, or if the patient is ambulatory anytime, and delayed onset of neck pain, which means immediately the patient, if we ask, the patient won't be having any pain at the time of trauma. Later time, over time, the patient will be having a pain. So delayed onset of neck pain. And the last one is the no spinal tenderness. So if the patient comes under these risk factors also, you should go for the radiograph as per Canadian C-spine rule. And further, if the patient is able to actually rotate the neck 45 degree to left to right, then if not able to rotate, then refer radiograph. That is, if the patient you have to check whether the patient is able to rotate the neck 45 degree left to right or not. And if they are unable to rotate, then you should go for radiograph. And if the patient are able to rotate, then no radiograph is needed. So these are the risk factors, major and low risk factors. And the concept behind the Canadian C-spine rule is to whether the radiograph is to be obtained or not based upon the blunt trauma history. Thank you.